Today is September 2nd, and we are actually in Toronto, Canada. And I'm having this kind couple in front of me. And may you please introduce yourself?
Hi, my name is Patrick Megaffin. Um, I live in Kitchener, Ontario, and I'm here with my wife, Christine.
So,
Patrick and Christine, please, tell us what is your relation with the ONZ in Germany, and when did you go there, and what did you get with them?
Oh, well, I guess it started in the fall of 2020, and I've been suffering with back pain since I was 15 years old. I was 57 at the time. I had surgery, and because of COVID, I couldn't get surgery in Canada because my surgeon here had closed his clinic. So my family doctor recommended I contact ONZ, and I reached out to them by email through their network and filled out all their paperwork and information. That would have been in October. And they said I was a perfect candidate, and we booked surgery for November 26th.
So, November 26th was your surgery, or what kind of surgery did you get? What did you have?
I had L5S1 right at the base. I had a fusion there. And then I had two disc implants, L4, L5, and L3, L4. And the purpose of that was because I had ruptured discs in my spine, and they felt that the disc implants would be a perfect fit for me.
So, surgery of 3 levels lumbar in November. How long did you stay at the hospital, and how did you feel the hospital care at that time?
Well, I had some setbacks during surgery. When I was 30 years old, I had a previous surgery, and that scar tissue from that surgery had affected a vein in my leg. So when I was in surgery, the vein broke open and they had to repair it. So normally you would spend about 2 weeks in Germany after surgery, but because of the complications, I ended up spending 4 weeks. But after 4 weeks, I was able to go home.
Were you taken care of all the time? Where you explained the situation? Did you meet enough specialists that took care of you adequately? What is your experience?
Well, I think I have a pretty unique experience because I was told that because of my situation, I used every aspect of the hospital's departments. So the people were
maternity.
Except for maternity, yes. The people were outstanding. They were friendly. They were very direct. They know their stuff. I mean, the surgeons are got to be the best surgeons in the world. I would recommend ONZ to anyone. The nursing staff are just amazing. They treat you with so much kindness and so much respect, and they look after you. I just can't speak highly enough to them.
Isn't that the way it should be?
It should be.
It should be, yes.
And I can add to that to say that they always made sure we understood what was happening at the time.
Yeah.
And because of the language barrier, it was always translated properly to us. If we didn't understand, I was able to ask the questions and make sure I had the clarification that I needed. So there was no issue with the language barrier.
Yeah, most everyone there spoke English, but there were some situations where they spoke very little English, so the translation was difficult. But there was one nurse who was amazing, and she had a translator on her phone, so we spoke to her regularly through her phone, and it was just outstanding.
So after your surgery and the post-surgical hiccup was taken care of, then did you go to a rehab place, and what was your experience at the rehab?
Yeah, we went to Recklinghausen Rehab.
What was that called?
Medicals of
Medicals,
yes,
yeah.
that's where we went to the courtyard.
Yeah,
Yes.
and they have quite an extensive program there to get you back on your feet. If you're expecting to have surgery and then sit around for weeks, that's not going to happen. You have surgery, 3 days later, you're up walking. 2 weeks later, or a week later, you're at medicals doing the rehab. You're you're going to classes, different classes, 4 or 5 or 6 different classes every day for a week before you leave to make sure that you can walk properly, make sure that you can handle yourself properly, that you know how to use the equipment that they give you, whether you have braces or crutches or a cane or a walker. They make sure you're recovering properly. And before you leave, all the staples or the stitches come out, so you're well on your way to recovery.
And now, question to you: how do you see your husband now? Has he changed? Has he become more positive and more actively participating in activities which he wasn't doing prior to surgery?
Absolutely, he's got more energy. He sleeps better. He's more flexible. He did try to golf before his surgery, but it was painful for him, and it would set him back for 3 or 4 days. Now he can go and resume his regular activities, and he's doing gardening. He's walking the dog all the time. It's just amazing, the experience and the difference in him before and after.
It's life-changing.
Yeah, it's very, very